Hi, welcome to another episode of Clear Light Connections, where we talk to the people behind the businesses of Bay Area Houston. We are proudly sponsored by UTMB Health. Special guest today is Dr. Kevin McKinney, and you are an endocrinologist at UTMB.
Correct.
In addition to faculty, as it says, so you're also a professor there.
Yes.
Tell us about endocrinology and what kind of got you into that and what it's led to.
So endocrinology is the specialty of hormones. And I got into that when I was a fourth year student at UTMB. I've been at UTMB since '88.
Oh, wow.
Was a student resident endocrinology fellow, and I've been on faculty since 1997. And so in 1991, when I was a fourth year medical student, one of the endocrinology faculty there named Dr. Randy Urban, I did a rotation with him, and he got me interested in the problem-solving nature that endocrinology had. And so that's kind of the path I chose because I kind of like that kind of work. I'm not much into operations. I couldn't do a procedure to save my life. And so I just went ahead and said, well, I like to use my mind and think and talk with people. So that's how I kind of got into endocrinology in that way.
So you mentioned you've been at UTMB your whole career.
Correct.
We find a common theme amongst the people from UTMB that we interview. What is it about the culture there that gets you there and keeps you there?
So, number one, I can't say I'm from the Houston area, so it's not like I had to move too far to go to UTMB. But at the same time, UTMB always had this feeling of family when I was started as a student. And then as we've gone along, they've always recognized people as family. Every 5 years you get celebrated if you stay there. And so I'm on my 30th year pen myself. And then so people, they recognize you as family, and I always felt that. So that's probably the reason why I stuck around with UTMB. I'd never had a reason to leave. I felt like I had a good career trajectory. Mm-hmm. And I also felt like people were nice. Every place has its own quirks about it, that's true, but I felt like our quirks are no different than other people's quirks. The quirks you know are better than the quirks you don't know. And so I stuck around for that amount of time, and I still enjoy my time there.
Yeah, and you talked about something interesting, and that tenure that you have. Talk to me about some of the growth you've seen, because it's been extraordinary, especially these last few years.
So it's been quite different. When I first started at UTMB, we were the hospital that took care of the indigent patients of the state of Texas. And so we get people from the Valley, get them from Central Texas. We even get some from West Texas, in addition to the ones that we typically serve in Galveston and in Brazoria County and Beaumont and East Texas. Well, we used to take care of many of the people that were there. But, that's not financially sustainable. And so with all sorts of things that changed on the state level, we, by necessity, had to switch around to taking care of people that were closer to us. And so we focused on our core areas of Brazoria and Galveston counties, and a little bit of Jefferson County. And with that, I thought we became a more focused institution. And so I think from the clinical side, that was one thing. The other thing that happened was that, as you know, Houston went from being a big city to a really big city. And so as we went along in the 2000s, you couldn't deny that the best place for UTMB to expand was onto the mainland, away from its home base in Galveston County. So that's when we started opening up a few clinics here and there, but then that strategy became a strategy of necessity after Hurricane Ike. And as y'all know, that kind of shut down the campus in Galveston for about 6 months. And so for us in endocrinology, we had a clinic that was there on Harborside. That was a primary care pavilion. And that clinic got flooded with water. And the only clinic we had was a little bitty clinic that we had in Texas City that had 4 rooms. And that sustained us for 6 months in that little bitty clinic. So
Wow.
we were able to take care of the patients that we had in Galveston. And
Made your
Texas.
team closer, too,
Yeah.
I imagine.
It was a struggle, but that made us a stronger institution.
Yeah.
And then finally, we had a new clinic that was built in League City at the Victory Lakes. And that became our focus of our endocrinology clinic. And so most of the patients we actually serve are on the mainland portion. We do have a few in Galveston. We have a nice little clinic in Angleton. There's a little small clinic there on the west side of Angleton, but it probably is the nicest little clinic you've ever seen.
Yeah, and that's what I've loved about getting to meet all of these different people from UTMB is how purposeful the growth is and how strategic it is. And they're really trying to meet needs.
Yes.
So March 22nd was National Diabetes Awareness Day. And the word diabetes keeps coming up in all these conversations we've had with, be it Dr. Kaiser or cardiologists. Why is it so important that we discuss?
So diabetes is, we think of it as disease of sugar, right? You know, that when your sugar goes high in the body, bad things tends to happen. You tend to be, the reason Phil Kaiser would mention is because when you have increased levels of blood sugars, the cells that help fight infection don't work as well. So that's why, the disease of the day is COVID. And so that's the reason why you see people that have diabetes and have high blood sugars, they're less able to fight off infection. And so when that happens, the body tries to figure out other ways of fighting out infection. And when it does that, it makes the disease kind of worse. And so that's the kind of things why you hear Phil Kaiser talk about it. But when sugars are high, other things are happening also, right? It makes your eyes worse. It can cause problems with kidneys and make your kidneys leak protein. It can cause problems with the nerves, especially the nerves that are in your feet. And so we worry about those things because they can affect the bones down there. They can affect the muscles down there. It can make you not feel things. And so we are always trying to help control diabetes in those areas because the worst thing that could happen for someone that's in their working years is to have something bad happen to their feet. And we try to prevent that from happening.
Yeah. I think if anything comes out of this pandemic, it seems to me, and from what I'm hearing, is that controlling diabetes should be it sounds like it is the biggest comorbidity factor for just about everything out there.
It is. Believe it or not, diabetes touches almost every specialty. Has a complication that can be associated from diabetes. Those in the obstetrics and gynecology world, if they're more prone to have infections down in the female area due to diabetes. Those that have psych problems, if you have diabetes and affects the vessels that feed the brain, it can make your psych problems worse. It can affect, we already know it can affect the nerves and it can affect the heart. Orthopedics, believe it or not, if it can affect the bones, because if you have diabetes, then people don't think of bones being a living portion of your body, but it is actually a very, very living portion of the body. And if the bones aren't getting enough oxygen to them, then they start having problems associated with them. So yes, diabetes tends to affect all tissues of the body if it is not controlled. So
given that, and hopefully a heightened sense of awareness that I think really, is going to come from this, let's talk about prevention, because that's, in most medicine, prevention, they always say prevention, ounce of prevention is, well, I'm not sure, I'm not really good at idiomatic expressions, but you know where I'm going with that. So if we can prevent it, we don't have to treat it. So talk about preventing diabetes.
And so the main way that we have people to help try to suggest they prevent diabetes is to, number one, try to control the things that you can control. We can control what we do with our days, and we can control what we put in our mouth. And those are the things that we should focus on to try to prevent people from having diabetes. Yes, diabetes does have a family history associated with it. Some people are more prone to having diabetes, but even if you have a family history, you can do things to try to at least increase the amount of time before it shows up. And so prevention is important. What can we do to prevent things from happening? So number one, you can determine if you or yourself are at risk. And so you can look at your height and you can look at your weight and you can put that into a formula that's called the body mass index. And you can do that online. There are plenty of BMI calculators. And if that number is above 30, you are at high risk for developing diabetes. If that number is at above 25, between 25 and 30, then you're at an intermediate risk of developing diabetes. And that you should probably let you know that you need to start thinking about things you can do to improve what you can to affect those two things. I try not to use those phrases, diet and exercise. I try to say you need to improve your nutrition and you need to increase your activity. Those are the things that I prefer to use.
It's a nice way to say it.
Yeah, so because diet is diet with a T, and exercise, people think you got to join the gym. And so I think you can do things other than that so that you can.
Here at the credit union, instead of saying a budget, we call it a spending plan because people actually like spending, but they don't like budgeting. So very similarly. My father-in-law had diabetes, and he used to go up and down. And if he was bad at eating sugary snacks, then he would have to skip meals. And can you tell me that? And I think a lot of people want to know. You hear about type 1 diabetes and type 2 diabetes. What are the distinctions there?
And so there's actually several different types of diabetes, but yeah, those are the main two ones. Neither of them are rare. So type 1 diabetes is the disease where the body, for some reason, identifies the organ that makes insulin, which is called the pancreas. The body thinks it's foreign, and so it starts sending antibodies after the cells that make insulin. And so over years, that can start affecting the body's ability to make insulin. And that's type 1 diabetes. And so eventually, once you lower the amount of your body's ability to make insulin, you start developing high blood sugar. And so that's the one form there. For kids, it tends to happen pretty darn quickly. You'll see them, they'll lose a bunch of weight. They're urinating all the time, feeling thirsty all the time. And they end up in the hospital with a condition called diabetic ketoacidosis. However, it is increasingly recognized that there are adults that have type 1 diabetes also. In those patients, it doesn't happen that way. People see that they're an adult and developing diabetes, and they think that it's type 2 diabetes because type 2 diabetes is far more common. But it can happen to adults too. So type 2 diabetes is what happens when the body is not able to effectively use the amount of insulin that you make. And so the body becomes what's called resistant to insulin. And that tends to happen a lot more, and it tends to happen in people that are bigger than what they should be. So, if you have a BMI that's greater than 30, you're likely to have a certain amount of insulin resistance. So that's an epidemiologic thing where we've seen the data shows that there's a correlation between weight and development of diabetes. Now, it's not only happen in adults. We see a lot of kids that have type 2 diabetes too. Where do we say that diabetes starts? We say it starts in the womb. And so if you're an expectant mother, it's important for you to treat yourself right so that your child comes out healthy, because if the child comes out heavy, chances are they're going to be heavy for most of their life. And so that's why we say that it's always important to treat yourself correctly, especially during the formative time of pregnancy. So type 2 diabetes can happen to kids. You're more likely to see it in adults. Type 1 diabetes tends to happen to kids, but you can see it can also see it in adults. The amount of people that have type 1 diabetes is much less, but it's not rare. So the 1.5 to 2 million people in the United States have type 1 diabetes, while about 30 to 35 million people in the United States have type 2 diabetes. So neither of them are rare.
But the second one is more preventable by activity and nutrition.
Correct.
Okay.
The second one is type 2 diabetes is more preventable than type 1 diabetes. There are people that have done studies to try to figure out certain ways of preventing type 1 diabetes, but that's mostly in people in which they've had family members that have had type 1 diabetes show up.
Okay.
But type 2 diabetes is the one that shows up more. It's also family member driven, but it's also environmentally driven too. So how you treat yourself can affect the development of type 2 diabetes also.
And so tell me what UTMB and your department in particular is doing to help get the word out there about diabetes and what we need to address.
So we are actually starting on the prevention side. We have a grant from the Department of State Health Services that has a diabetes prevention. So we have if you look on our website at UTMB, you'll see that if you want to type in the search bar diabetes prevention and care, you'll see that it gives you a way to find out if you're at risk for developing diabetes or what we call pre-diabetes. Then you can do that, and if you have pre-diabetes, then you can consider joining one of our programs that we have that's called the Diabetes Prevention Program. And with the Diabetes Prevention Program, it's a year to 2 years of attending classes with our facilitators and lifestyle coaches. And we help you with learning how to manage your life, learning how to manage your eating habits, on how to do your grocery shopping, and on tips on, if you can't get this much walking in, well, do what you can do. And so and we do that on a weekly basis for about a year, and then they go off to less frequent time after that for the following up year. And so that's the program that we have available at UTMB. It's a grant funded, so it costs nobody any money. We have a program for that, not only by State Department of State Health Services. We're trying to work with Blue Cross and Blue Shield to try to offer it to those people that are their beneficiaries, but are at risk. And so those programs are what we have. So number one, we're starting out with the prevention side. So let's define prediabetes first. So prediabetes is what you have before you have diabetes. And we do that by doing this test called the A1C level. Y'all may have heard about it before. And the A1C, if you have diabetes, is at 6.5 and higher, 6.5 and higher. If you have prediabetes, that A1C test is at 5.7 to 6.4. So if you go online and find out if you're at risk for prediabetes, you should go and get that A1C test done. And that'll let you know if your status is normal, prediabetes, or frank diabetes.
And that's become kind of a standard test with most primary care physicians,
Correct.
From what I can tell. It'd been a while in between office visits, and there was a whole gamut of tests this time, and that was one of them.
So it used to be that you had to send off for your A1C test to be done at the lab, but almost all clinics, at least in the UTMB system, have an A1C machine available for them. And so if they think that you're at risk for diabetes, they'll stick your finger there, they'll run it through the machine, and then in 6 minutes, they'll have the answer on what your status along what we call that continuum is. Are you normal? Do you have prediabetes, or do you have frank diabetes?
Okay.
Yeah, any primary care doctor should be able to do that.
Yeah.
As well as us in the endocrinology clinic.
Well, I appreciate you coming on. Like I said, it's been such a common topic that I thought, we should devote some more time to learning about it. And is there anything else you want to tell the audience before we part? Any final words of wisdom?
So if you do have diabetes, it's important for you to make regular clinic visits with your primary care doctor. They're the ones that treat diabetes most. Those of us in endocrinology, yes, we're the specialists in diabetes, but we tend to get patients that are a little bit more complicated. Number one, we probably handle more of the type 1 patients, the patients that have type 1 diabetes, and those people that have type 2 diabetes but are using a lot of insulin. But you should at first establish with a primary care doctor if you're at risk for prediabetes or diabetes, so that you can get on top of it early. One of the shames is that for those people that have type 2 diabetes, one third of the population doesn't know that they have it, because it doesn't cause symptoms until it gets really darn bad. Mm-hmm. And so it's important to get on early with finding out what your status is, so that you can prevent those bad things from happening 10, 15, 20 years down the line.
Yeah. Well, thanks again, and it's been a pleasure.
All right, thank you.